Welcome. Hello, everyone. Thanks for being here today. Welcome to How to Best Position Your Health and Wellness Center. Every healthcare organization, whether a health and wellness clinic, center, or practice, faces fierce competition as a healthcare provider in today's world. Even with a premium array of health services all in one place, it's hard to break through the crowded market to keep top talent and your patients happy. That's why it's more important than ever to have a clear market position. You need to be clear about who you are, what you do, why you're in business, and how you are different. That clear positioning needs to align, grow, and live within your team and patient experience. I'm going to show you my process on how to create a compelling and clear brand position in the market so that it resonates with your patients on a very deep emotional level to increase purchasing power, build loyalty, and become not only a beloved brand, but your own category of one. My name is Michelle Roberts. I am your host. I am marketing advisor to health and wellness organizations. I have a passion and I feel proud to be able to serve the health and wellness organizations on a level that I am. I believe that there is a true revolution coming to healthcare, and I'm excited to be part of that transformation. I am also an artist. I make messenger birds. They're a little clay bird that I craft myself, and they hold messages to people. You buy one, write your own message, and send it away as a gift. I do that. I have art. I have a little dog, Shiba Inu. You can see from the top left, she is a very charismatic dog. She acts like she's still a puppy, but she's not. And there I am to the right. So again, happy to be here with you today, and thanks for spending time with me. On our agenda today, we're going to be talking about effective brand positioning. What is positioning? Why is it key? What happens when your positioning is unclear? What are the pillars of positioning? We'll look at good examples of good and poor examples of positioning. We'll look at positive learnings and pitfalls, and how to develop your differentiators, along with how positioning really fits within the larger system of your marketing. Effective brand positioning happens when your organization is perceived as favorable, valuable, and credible. Some of these brands might look very familiar to you. We have Nike, who's very clear on their position. They understand their market, they understand their competitors, but they also understand how they can stand out, and they've developed an entire brand around this idea of just do it, or in other words, authentic athletic performance. What's great about these brands is that they lead with these ideas, right? They're not trying to sell you their products or services. A great brand's position understands that to really connect to the hearts of their customers, it's all about putting this big idea, this cause, movement, or belief behind what they do. And they start with that, the very core. Rather than trying to sell on feature functions or benefits, they start with emotion. But to have great effective brand positioning, you really need to focus on 3 areas. The brand has to be credible. So it means that you need to, if you say that you're all about recycling and being good to the planet, then the actions and behaviors better align with your messaging and your positioning. So you have to be credible. You have to be valuable. So it's more important now too than ever is to have good quality product or service. So that's the second part. And the third is favorable. So people and consumers, patients in this case, they need to understand what's in it for them and why they should maybe go to your health center versus going to the one down the street. What is brand positioning? Well, it's kind of a combination of all of these things together and how they're marketed, how they're lived within your brand, within your team, and within the experience you provide. So we start by saying that it's a succulent, possibly one sentence And it's typically you're expressing that you're this category of one, something different, something that no other center is doing. It's a translation of product or service benefits into meaning for your consumers, right? It's not talking about the fancy products or services. It's more about this idea of intangible benefit that has a emotional connection meaning to your consumers or patients. The company's core idea or why. Yes, we can give credit to Simon Sinek here with the big why. Now, this is truly important as well because starting from really a great positioning is starting within. So understanding what your core identity or your core why is. It also needs to be relevant to the needs, wants, and desires of your key stakeholders, in your case, patients. It needs to draw them in. It needs to connect with them. It can't be something that doesn't at this point. There's a relative to the market's alternative choice. So basically, your positioning needs to do what your competitors aren't doing. And it's how a company's offering is perceived by consumers, the place it takes up in the consumer mind. A great positioning allows the potential patient, to understand what their perceived value that they're going to get from you versus going to someone else that is in your competition. Why is brand positioning so key? Well, for one, your reputation matters. Attracting talent matters, attracting other providers to your center that really align with your value set. So your reputation matters immensely here. Again, people, they have to understand what you do. It has to be clear, right? Because there could be missed opportunities there if you are not telling the right story, if you're not talking about the products or services that you actually perform at your center. The reputation matters immensely. Employee retention. So again, it's that positioning of this is what we're all about as a team. And this is why it matters to us. This is what we value. This is how we're different. And that in turn can increase your retention with your team members and providers as well. Differentiation controls the market share. Again, talking about this idea that positioning is key because people need to understand why you are different and why they should go to you versus somewhere else. The positioning could also improve culture. So this allows for everyone to get on the same page, singing the same song, telling the same stories, so that there's a very clear position to the patients and potential patients and to the world and to the community. It also impacts the bottom line, and all of those things above contribute to increasing your bottom line and increasing the patient experience rating. So we all know as healthcare owners, center owners, our patients matter. We're becoming and transitioning more into a patient-centered industry. And so all of this positioning can increase that rating. It can increase your ability to be able to help them in ways that maybe you weren't before. It increases the business value and then also your brand loyalty. So again, that patient retention that we talked about, people keep coming back to a well-positioned brand, a well-positioned authoritative brand in the market. The holy grail of positioning is essentially becoming a category of one. And this term is used by us marketing folks, and it essentially is defining the brand in a way that is meaningful and highly compelling to your target audience, while also allowing only one brand to be in the category's consideration set. This is easier said than done, and few brands really have truly been successful at achieving this. But creating a category one creates a first mover advantage, and depending on how fast one can scale up, significant economies of scale and network effects. This creates tremendous financial advantages for the category of one. Brand and barriers to entry for Me Too-like brands and other subsequent of competitors. For example, a category of one may be, if you think of a traveling health services organization as a category of one, not only is it just like a health services, but there's something like a primary care visit or a pharmacy delivers, or even a drone delivered medical supply company. So it's out of the box. It's doing something different, but it's something clearly needed or desired by the potential patient. So those are just a couple of examples. Why brand positioning is the bedrock to success? Well, we kind of already mentioned a few of those things, but in essence, a great positioning communicates the true value behind what you do as healthcare providers and owners. A strong healthcare brand position communicates the brand value with consistency, clarity, conviction, and credibility in a way that has meaning for patients and is unmatched by their other companies. It's also crucial to the bedrock of success in a way that helps a company rise above the noise with a distinguished, valuable offering. It helps to communicate the value of your product, service effectively to your patients. Essentially, positioning is this idea of aligning what you want people to think about your healthcare organization and what people actually do think about it, and vice versa, right? It's almost like, how do we dress your healthcare organization and center? How do we dress that in a way that is the most authentic way possible, but also is able to help your patients see the right things and set the right expectations for your center or clinic? So what happens when your position is unclear? Well, typically your messaging is off, right? Potential patients may not understand why your care is specifically for them, which creates them to possibly go somewhere else or to delay their making appointments with you. There is also a possibility of inconsistent care. So this idea that value perception declines when there's unclear messaging and positioning in the market. Patients don't sign up or as often. They go elsewhere because they can't tell the difference between what you're offering and the place down the street is, just like we've been talking about previously. What can happen when you have unclear messaging and positioning, and you're kind of saying the same thing as everyone else? You're possibly, you're falling into what we call the commodity trap. So if you're not a category of one, then you cannot afford to be also a commodity, right? Because commodities are offerings that people can't differentiate from one another. They serve the same need, solve the same problem, and deliver the same value. Brands and the part of the positioning is really used as a powerful tool, because a brand is something so different. Brand is the opposite of a commodity. It tells people how you're different, who you are, who you serve, and deliver an exceptional experience. That type of experience comes from great positioning and then floods through all your patients' experiences. And then, of course, people talk about it, right? So positioning is the underpinning of, it just creates this powerful tool that can help boost a brand and create the opposite of a commodity so that you can really sell your services in a way that attracts more of the right customers. When we talk about positioning, there are 5 different pillars, essentially, to really focus in on. And again, this is my process, so other advisors may differ on what their positioning is. And there's a lot of different ways to look at this, but here are the true pillars around where do we start when we talk about positioning. Well, first we have to define your audience. You got to define your segments, understand not just their psychological personality, but they're also their personality traits, right? Not just where they live, but what do they like? What are they interested in? And from there, part of it is defining your purpose. So the purpose is, this idea that how are you creating bigger impact with the work that you do? What's the why behind what you do? And how is that being articulated, communicated, and flooded through the rest of your organization? And we look at brand essence. This is the action that your organization takes to fulfill its purpose. This is crucial because a lot of times your essence is essentially, it's that core piece, right? It's how you do everything in your organization. From answering the phone to how you treat patients, to how your website looks and the tagline that's developed. So these are all really crucial pieces. And the next one's brand personality, one of my favorites. Brand personality is looking at your healthcare organization as if it were a person, and what type of personality traits would it embed and express. And so, looking at one way in which you can really set yourself apart is defining this personality and humanizing the brand in a way that your tone, your copy, your visuals all communicate this specific personality. And the last piece is, of course, the factor or the category of one that we've already been talking about. So what are some good examples of positioning? What are some good brands out there that we can relate to, that we can take a deeper dive into? The first one is Peloton. Peloton is a favorite of many. They do an amazing job at their positioning. They offer convenience by being able to create a fitness regimen around your own timetable rather than a gym schedule. They live stream studio classes and also can be selected based on your fitness level. The headline is a private indoor cycling studio in your home, and their value prop, or they're part of their big piece of their positioning, is that they own this idea that they offer convenience by being able to create a fitness regimen around your own timetable. So that's part of their selling, that's part of their positioning, as this idea that we built this around you. And they've experienced some big growth recently, raising significant trends towards fitness and healthier lifestyles. So that's all part of their positioning, and they do a really great job. The next one is a health center, Trillium Health, and this is their website. Their main message and positioning is we're a community health center providing judgment-free and affordable care. What does this say? This says that their value prop, their positioning really plays into this idea of accessibility. They're providing high-quality healthcare to everyone who walks in the door. This is another great brand. It leans more towards the fitness, but lifestyle brand in the health and fitness industry. This brand is all about high performance living. Can you see that they've brought this one big idea to life? Their positioning clearly states actionable, inspirational, emotionally connecting. They also have declared that their essence, or that one big idea that plays into one of your pillars of your positioning, is that they're all about high performance living. And they use certain words to evoke that idea of high performance living and that value that comes with that, and really what that means to be part of their community. And the name of their organization is called Equinox. Here's another great brand. They are internationally known as well. And I really liked their positioning because, for one, it feels light. It feels airy. It feels like if I were to go there, I would get a luxurious health and well-being stay. I would I would not want to leave, I guess. The brand stands for, I think, this luxury, but also this innovation for natural therapies. So based on their positioning, they've kind of created this ideal situation where people can come to heal. What I really like about this too is the photo that they used. The photo was used very strategically to reinforce this idea of this big journey that probably we're all on, and facing a long life of health and wellness. And so they've done a really good job of using the right words, the right photos, and really identifying that, when you come here, it's medical innovation, natural therapies, and healthy nutrition, and they're holistically positioning themselves. So I thought this was another very effective positioning example. The next couple slides are a couple of private practice organizations, healthcare, that I've worked with that we've essentially worked with their positioning in their team to come up with some new ways of doing things. So this was a private practice locally in Rochester, New York. Where we started, they had just gone through a change in leadership. There was a new practice, considered a new practice, essentially. There's a new team working together. They had worked together previously, but not in this close-knit capacity. There was a new name. There is a new way to communicate. There's no true way to communicate about what makes them different. They kind of sounded like a lot of the other practices in town. So what we did was we interviewed their internal stakeholders, we interviewed their referral partners, we interviewed their patients. We changed the positioning and messaging to indicate a larger movement behind the organization. It wasn't so much that they were giving you great smiles, as it was that they were restoring wellness, so that everyone can live a more healthier life. We aligned the team and new members who streamlined all of their ways that they communicate and talked with their patients. We defined their positioning statement and added it to the website. We aligned touch points. And by the end, there was a huge transformation. They were able to increase their awareness, credibility, consistency, increase their perceived value. I should say it's more like we elevated their perceived value to align with their actual value. They now stood out. They now stood out from others. And some hard numbers, but we were able to create consistency in the team communication and workflow by 39%. And we cultivated awareness of care for the customer in the daily processes to increase efficiency as well. So you can see we did not only the positioning work, but we then took that work and implemented it into other series of workshops where we took a look at their patient experience, their communication, and their marketing. So for example, the telephone, we changed how they answered the phone. We also held monthly wellness events for their current patients we brought in different leading experts around health and wellness. And we even changed her email signature to with health in mind rather than yours or best. So it was a way to reinforce that idea on a different level. And this was what my client, Dr. Marianne Lester, had to say about our work together. And those that are rewatching this, I'm sure you could pause, and if you wanted to, you could reread this. Another organization that I had the opportunity to work with was Mindfulness Practice and Medicine. When we started working together, when I asked them what they did, they told me they sold programs, which they did, and they do. But they just didn't know how to market. There wasn't a clear positioning. They didn't really know how to talk about what they did. And they needed to really restructure some of their offers to create a better position, right? Because part of the foundational elements of having a great position is having a clear way and clear structure around your products and services. and making sure that those are services and products that there's no gaps between what they offer. So what we did was we held several focus groups. We changed the positioning and messaging to an unknown to now they say we're all about helping clinicians thrive. We defined their purpose and their essence. We modernized the logo, look and feel based on the positioning and based on the brand pillars. We shifted how they thought about what they did, who they are, and why they do what they do. This was huge for them. They had a ton more confidence around how to talk about the true impact they have on their clients and their providers. And so that was it was wonderful to see that. And that made a big difference in how they talked and the people that they reached out to in regards to partnering. And so they could very much better talk about what they did and who it was for. We also updated all the marketing materials to the programs and beyond. So some of the testimonials from both of the doctors that I worked with on this particular case study. So what are some examples of poor positioning? Well, we looked at some really great ones and we went through some case studies. Now let's take a look at what is an example of poor positioning. Now you might be thinking, this website looks beautiful. It's very pretty. It's a nice layout. Yes and yes. However, there's nothing on this website that talks about the bigger impact they want to have on their community. There's no tagline. There is nothing about their methods. There's a lack of positioning here, and especially when it comes to the photo, unless it's a really hard place to find. Having a photo on your website to reinforce your positioning is not needed. It does say what it is, which is a health and fitness center. However, again, who's it for? What are they going to get what's the value that they're expecting to receive here? Where's the personality? It's such a huge missed opportunity, right? So you might be thinking, well, this is not as pretty, which is true. However, they do offer, they do have a bit more of the positioning down here. So it's kind of contradictory, but to think that a not visual site if having a pretty site doesn't mean that you have great positioning. And so this was an example of comparison between the two. So I thought that was a good example. Not to say they couldn't use some visual help. Absolutely. That would definitely increase their ability to attract more patients, I'm sure. However, when you look at the two, you can clearly see one is lacking versus the other. One has it right, the other one has it wrong. One has it wrong, the other one has it right. So what are some positive learnings that we can take away after looking at our examples? So an effective positioning and messaging is not skin deep, right? We talked about when we looked at Perio Health Partners, we looked at taking that positioning and those pillars and expanding and integrating those into the everyday experience and processes and technologies that support the overall experience that the practice is giving and is establishing with their patient base. Use your website as an opportunity to express your brand positioning. Your websites are most likely the first place that your potential patients will find you on Google, and that is your one point of entry that cannot be unclear, right? Use people as relational objects to reinforce your target audience. It's just like we looked at the Health and Wellness Center example. They used a person that looked like they were on a journey with themselves, right? There was beautiful aesthetics there. They pick the photos so that people of the target audience can have a relational experience with that photo. They can see themselves in it. And the last one, positive learning, don't be afraid to change to better communicate your message, right? Like we learned in the couple case studies, be open to when your position changes, a lot of other pieces within your center, the way you do things will often have to change to reinforce an effective brand position. Be aware of these pitfalls. So typically, shorthand, there are areas of expertise, and we tend to, when we have a center full of providers offering an array of different services, there's always this kind of knee-jerk reaction to say that we are a one-stop shop. I think of convenience stores. They're the one-stop shops sometimes for people. And so, but I'm here to tell you that it can be sort of a devaluing part of your positioning or messaging. And what I've found to discover in working with a ton of healthcare organizations and specifically centers is that it kind of comes down to 3 core benefits, right? So part of your messaging and your positioning is maybe not saying one-stop shop, but to consider maybe those core benefits, to maybe more clearly talk about the unique value that your center provides is 1, choice. Do you offer a broad selection of products and services than your competitors? So is it a choice? Is it about service by coordinating multiple products and service and capabilities, often disparate or disconnected? You're able to serve customers more fully. So is it about that service or is it about price? One-stop shops are about price, right? Sometimes. And the size can lead to economies of scale and provide a platform to pass greater savings on to your customers. So this is where we need to be careful, because when we say one-stop shop, it typically means one or 3 of these things, but we're just not taking it to the next level when it comes to clarity. So instead of saying one-stop shop, I would like you as health and wellness owners, health and wellness center owners, practices and clinics, try considering using coordinated care or multidisciplinary approach. This will give a clear value and message to your potential patients and patients around what makes you different, or your approach, or your method to how you treat your patients. What are 4 things to consider when developing your brand position? 1, who will be part of your research? Typically, you want to interview a couple of your patients, current patients, at least a couple. Typically, you could even have a focus group, like we did with mindfulness practice and medicine, like I did with them. Be honest with yourself and team about what makes you and your team special. Sometimes we have ideas about what makes us special because we've clung to these ideas. And our patients may not find those same things of value, or they may not agree. So it's really important when developing your positioning to really look at the practice honestly and think about what makes your team different. The next thing to consider is you have a great positioning. Now, what to do with it? So thinking of how can you embed it into everything, not just about perfecting the positioning, right? So don't wait months before starting to shift your organization, your communication, your marketing, your experience. How will you align your words and with actions to create an unforgettable brand experience? So that positioning directly correlates and creates that unforgettable brand experience that your patients will talk about for years, right? It's not just about the care, the amazing care that you're giving too. It's really like how can you be credible and align your words and actions to create something that is capable of being that category of one. And then lastly, how can you be one thing to type of one demographic? If you think about the life cycle of your brand and the patient. So again, going back to, yes, we did the research. We're looking at ourselves honestly. We're looking to create more than just saying how we're different, but we're actually going to start living that and using the pillars. Now, what demographic, how can you be that one thing to them, to your patients? So think about the life cycle of your brand too, and where you're at, and the patient's life, the life cycle that they're in, and how does that contribute to your overall positioning strategy as well. So where do you start when you start to think about your steps to develop your brand position and your differentiators? Well, the first thing to do is to outline your market segments. So what market segments exist? Research and analyze the marketplace. There are a lot of different data points and surveys and focus groups that you can run to really get an understanding of your market segments. Second one is define your brand pillars, like we talked about. Hire someone, have someone internally help work with that person in developing and understanding what your pillars are. Third, choose which segments. So determine which segments that you want that you're best equipped to serve, right? Because you may want to serve teenagers, but you're really built for serving women over 40, with your particular service, and so on. So that's just an example. Fourth is consumer insights research. That's where, we talked about really diving deep into creating personas around this consumer insight, and interviewing your patients. Find out what they think about you. What do they think about the experience, your positioning, that emotional connection that creates a great effective position. Fifth, competitive audit. Just Google some of your competitors. Look at their websites. Take a look at what they're saying, like how they're different, and do the opposite. Even maybe go there if you want and take a walk through. Right? Get a really clear understanding around your competitive landscape. And then lastly is effectively communicate your positioning. So like we looked at your websites, your marketing strategy, your experience, how customers are greeting you, or how patients are being greeted, and so on. So where does the position fit within larger marketing system or strategy? We've kind of talked a little bit about that already, but the basis of it is kind of like when you build a house, right? If you think about your organization as a home, we build the foundation first. And that brand positioning and messaging is like building a full foundation. What happens if you don't have a foundation in your house and a hurricane comes along, tornado, right? All that gets blown away. And so to create an effective brand position, an effective organization that can equip the patients with the quality care they want to receive, you really have to focus on building a foundation and building up from there for a total, if we want to go there, like a total brand creation and authority in the market. And so this foundation is really crucial to developing that, and that's where the positioning falls into play. And those basic outcomes of positioning, yes, there are intangible things that happen. We talked a little bit about them in the very beginning slide, but essentially we want internally, what do? We want to establish that. We want to change and shift the thoughts, action, and behavior around all of these pillars, which are in the center. And then externally, we want our patients to feel in how they talk about us to others. We want to be able to establish that. And the way that we do that is really truly spending time and developing your positioning. So let's work together. I would love the opportunity to sit down with anyone. And thank you again, everyone, for being on today's webinar and taking time out of your busy, busy days to do this. Thoughts, questions, like I said, complimentary. And also those that want to, please let me know. I can send you, we can establish a time and day to set up a meeting so that I can bring you through and share with you, physically share my Asana blueprint template, which entails my step as a process on how to build your healthcare brand, including the brand audit and the worksheet that's included within the Asana board. So I'd love to spend some time, won't take long, maybe 10 minutes, to just kind of go through with you and give this to you and answer any questions that you might have with that. So I look forward to hearing from you. Thank you again for everyone, and hopefully we will talk soon.